Welcome to Health Diagnosis. Today, we're talking about a topic that's often misunderstood or ignored: the health challenges that gay individuals can experience, not because of who they are, but because of the social pressures, stigma, and barriers they face in healthcare systems around the world. Being gay is completely natural. It's not a disease, not a disorder, and it doesn't come with biological side effects. But the world doesn't always treat everyone equally, and that inequality can affect both mental and physical health in real ways. Let's start with mental health. Studies show that gay men and other members of the LGBTQ+ community experience higher rates of anxiety, depression, and stress compared to the general population. This isn't because of being gay itself, it's because of rejection, discrimination, and the constant fear of being judged or misunderstood. When someone grows up hearing negative messages about who they are, it can take a toll on self-esteem and emotional well-being. For many, coming out, sharing their identity with family or friends, can be a major emotional challenge. Supportive environments can make that experience empowering, but in unsupportive or hostile situations, it can cause severe stress, loneliness, or even trauma. That emotional weight can sometimes lead to unhealthy coping habits like substance use or social withdrawal. Another serious issue is suicide risk. Research has shown that gay and bisexual men are at higher risk for suicidal thoughts and attempts, especially in environments where they face bullying, discrimination, or violence. The good news is that having just one accepting friend, family member, or support group can drastically reduce that risk. Acceptance saves lives. Now let's talk about physical health. There's often a lot of misinformation around gay men and sexual health. Gay and bisexual men can face higher risks of certain infections, such as HIV and other sexually transmitted infections. But that's not an inevitable result of being gay. It's about awareness, prevention, and access to healthcare. Safe sex education, regular testing, and the use of preventive tools like PrEP and condoms are powerful ways to stay healthy. Unfortunately, stigma can make it harder for some people to seek care. Many avoid going to doctors out of fear of judgment or mistreatment. In some places, healthcare providers aren't properly trained to discuss LGBTQ+ health needs, leading to misinformation or discomfort on both sides. The result is that preventable conditions can go untreated. Creating inclusive, judgment-free healthcare spaces is essential to closing this gap. Social isolation is another factor. Some gay individuals are rejected by their families or communities, which can lead to loneliness or economic hardship. That isolation can affect mental health, increase stress, and limit access to stable housing or employment. Community centers, online support networks, and inclusive organizations play a huge role in providing connection and safety. It's also important to talk about body image. In some parts of gay culture, there's intense pressure to look a certain way, to be muscular, lean, or fit. This can lead to body dysmorphia, eating disorders, or unhealthy exercise habits. Health isn't about perfection, it's about balance and self-care, both physically and emotionally. Substance use is another area of concern. Because of social stress and discrimination, some people turn to alcohol or drugs as a form of escape. This can create cycles that are hard to break. Supportive therapy, community programs, and honest conversations about mental health can make a huge difference. But there's good news: awareness and understanding are improving. Around the world, more people are realizing that health equity includes everyone, regardless of sexual orientation. Many organizations now focus specifically on LGBTQ+ health, offering counseling, testing, and education in safe, inclusive environments. One of the most powerful things any of us can do is listen. If someone opens up about their identity or health struggles, listen with empathy. Don't judge. Don't try to fix them. Just listen and support. Small acts of understanding can have enormous effects on mental well-being. If you're gay or questioning and struggling with mental or physical health, please know this: you're not alone. There are doctors, counselors, and community groups who specialize in LGBTQ+ health. Seeking help is a sign of strength, not weakness. And if you know someone who's struggling, reach out. Let them know they matter. Health isn't just about the body. It's about the mind, the environment, and the way we treat each other. When society is accepting, people thrive. When people feel seen and supported, their health improves. At Health Diagnosis, we believe that everyone deserves respect, care, and accurate information. Being gay isn't a cause of illness, say Stigma is. Let's work together to replace shame with understanding, and fear with compassion. Thank you for watching Health Diagnosis. Take care of yourself, and take care of each other.